Hi, my name is Marcy Zwelling, and I'm a physician here in Long Beach, and I want to talk to you about stem cells. I do have a bias, and I do have a conflict of interest because I actually sit on the board of Next Healthcare, and they do stem cell testing. But I sit on that board because I believe in this so strongly. Stem cells are such an easy thing to grasp. Imagine if we could all go back to those days when our skin was soft and lovely. Imagine those days when we could go back to our childhood and have a heart that was robust. Well, the only difference is aging. And stem cells allow us to take a step back in time, to go back and actually redirect some of those cells and direct them to actually make new organ systems, better organ systems, non-diseased organ systems. It's a very simple test, actually, and what we deal with mostly is pluripotent stem cells. We take pieces of your skin, but I mean pieces, I mean a very small piece of your skin. We're able to send it to a laboratory, and they process this, and they actually take the cells and store them in a very, very, I'll say embryonic state. It's not really embryonic, but it is going back in time, so that what this cell is able to do, it is able to actually become a heart cell, a liver cell, a kidney cell. Remember, we all come from one cell. So really, the way we were developed is all about stem cells. It's all about stem cells actually producing all of our organ systems. In 9 months, an entire baby is born. So we have seen stem cells do some miraculous things. We actually saw an experiment that worked out very well for a gentleman where we took stem cells and we actually recreated his trachea and replaced his diseased and cancerous trachea with a brand new trachea. We're seeing stem cells being used in heart disease and being infused into the ventricle of the heart and rejuvenating those heart muscle cells. There are innumerable places where stem cells will be helpful. The liver, the kidneys, the heart. I'm not sure the brain yet, but I'm sure that will be coming along. And it's not expensive. You can store your cells in any number of places. There are a variety of companies that are doing that these days. The question of when to do it, I think, is an important question, and I would say the earlier the better. Obviously, the more young the cell that you're going to revert back to a stem cell, the more robust that cell is, and the better the chances that will work. So I will say stem cell testing and stem cell saving is actually something that should be done in children. So as an adult, if you have a child, the best gift that you might be able to give them is having them get a stem cell extraction and storing their stem cells for future use. It could save their lives in the future. It's probably the best insurance you can buy.